Today I will be presenting a case report published in Journal of American Veterinary Medical Association. The topic is epithelial inclusion cyst in mare. The case highlights how these cysts can affect fertility and how can diagnosis and treatment be approached in this case. The patient was 17-year-old multiparous mare with 1 year history of infertility. The mare showed sign of nymphomania, had ovulatory cycles and enlarged right ovary. She had previously conceived, but the pregnancy was lost before the fourth month, after which she had irregular estrous cycles characterized by frequent estrous behavior. On physical examination, the mare was bright and alert with normal vital signs. Transrectal examination revealed a greatly enlarged right ovary, measuring about 12 by 10 and by 8 cm, and multiple cyst structure ranging from 3 to 56 mm were present on the right ovary. The left ovary appeared to be normal with small follicle, but no corpus luteum were found there. This figure shows transrectal ultrasonographic image of the right ovary from the 17-year-old mare. In this case, as we can see, the ovary contain multiple cystic compartments ranging from about 5 to 56 mm in diameter. The blue arrow indicates smaller cystic structures between 3 and 15 mm located near the poorly defined right ovary fossa. This multiocular or honeycomb appearance is a typical of epithelial inclusion cyst, where multiple fluid-filled spaces form within the ovary. These findings explain the mere enlarged ovary and her anovulatory cycle, consistent with the diagnosis of epithelial inclusion cyst. The main differential considered for this mare condition included epithelial inclusion cyst, persistent anovulatory follicles, granulosa cell tumor, granulosa theca cell tumor, and ovarian cyst adenoma. Based on the clinical finding, a diagnosis of epithelial inclusion cyst was made. A standing laparoscopic right ovarectomy was performed to confirm the diagnosis. The ovary contained multiple cysts with amber to dark brown serous fluid. Histopathology revealed cysts lined by ciliated to cuboidal epithelial cells surrounded by dense collagen, confirming multiple epithelial inclusion cysts. This image displays the enlarged cystic right ovary, which is removed from the mare. Panel A shows the dorsal aspect notices the significant enlarged ovarian parenchyma occupied by multiple large cystic structures. These range up to 56 mm in diameter. Panel B shows the ventral aspect with smaller cystic structure. In panel C, we can see the large cyst has been incised, revealing its content, a characteristic amber to dark brown serous fluid. The presence of this fluid within these multiple large cysts indicate the epithelial inclusion cyst complex. Panel D shows a resected portion for a closer look at the smaller cyst near the ovarian fossa. These cysts originate from the invagination of the surface epithelium at the ovulation fossa, which traps the fluid, leading the inclusion cyst. Epithelial inclusion cysts, also known as fossa cysts, are non-neoplastic and non-follicular structures that develop beneath the ovarian fossa lining in mare. They are common in older multiparous mare and are thought to result from repeated ovulation causing the inclusion of epithelial cysts. As these cysts enlarge, they can obstruct ovulation and lead to infertility. The mare was treated with a right unilateral ovarectomy. She recovered uneventfully and was discharged 2 days later. About 2 weeks post surgery, she showed signs of estrus and was successfully mated. A pregnancy was confirmed, but unfortunately, it was lost around 8 months of gestation. To summarize, epithelial inclusion cysts should be considered in mare showing ovarian enlargement with normal hormone profiles. Diagnosis require careful ultrasonography, hormone testing, and histopathology. Unilateral ovarectomy not only confirm the diagnosis but can it also restore the fertility.